I'm Victoria, I'm the Postpartum Physio, and I am the newest member at Injury Armour, and I'll be working as a pelvic health physiotherapist. I came into pelvic health after initially writing my blog, which is the Postpartum Physio, which is mainly research led. I had my daughter and I had quite a negative experience myself of rehabilitation after having a baby, and I wanted to better women's health services, and so I started to go on courses, expand my knowledge, reading more research, and came into the profession that way. After I had my daughter, the main reason I sort of felt let down around services was, I think, a lack of education and a very kind of old-fashioned view, not necessarily looking at the research, just around kind of not lifting, not exercising, especially with the birth injury that I sustained. And I knew from my basic physio training many years ago that just wasn't going to benefit me, and I just needed to figure out how it was going to benefit me and use the research and my knowledge around that, basically. The patients I commonly work with are women who are experiencing pelvic pain with sex, who are postpartum, who are pregnant, so pelvic girdle pains, prolapse patients, any kind of patients that are experiencing any kind of pelvic symptoms of any age as well, and any kind of point in their journey. I think that's really important as well, because people focus on postpartum being X amount of weeks after you've had a baby. Technically, yes, but technically no, because I think once you've had a baby, that's you've always had a baby. So that lasts for quite some time. I currently have people on my caseload that are between 17 and 74, so people of all ages too. And that's why I'm really glad that I have my blog and the Instagram, because people will Google it and it comes up there, so they can see normal people doing normal things, and the blog of how to get back to sex after having your baby. No one tells you how to do that. No one tells you that actually it doesn't just have to be straight penetrative sex. There's so much pressure. And again, the healthcare advice that I had, just have a glass of wine. That was genuinely what a nurse said, so a practice nurse said to me after going for a really miserable smear test 9 months after having my baby and having to be repaired in theatre and all sorts. She was like, should I just relax and have a glass of wine? And I was like, okay. It wasn't good. I think my favourite aspect about my job and this aspect of physiotherapy is meeting so many different people with all their different stories and why they're coming in to see me. So predominantly I do a lot of listening. It's hard to believe because I also do a lot of talking. But I do a lot of listening in the first instance to really understand where someone's coming from and how best I can help them. It's amazing because the results that we get and how people always walk out feeling lighter is probably one of the most important things for me and why I love doing what I do. So I describe my approach as being very relaxed and very friendly and welcoming. I think that's really important because some of the things that we discuss in clinic are incredibly private for people and hard for people to discuss sometimes. We're not talking about knee injuries, we're talking about injuries to our pelvic floor and sometimes some very personal symptoms. So it's always very welcoming, very relaxed. And sometimes we may not get done the object of the assessment. Sometimes it may be really taking the time to talk through things and make people feel comfortable. That's really important for us as a service. The services that I'll be providing at Injury Armour predominantly are what's formerly known as the mummy MOT. We call it the postnatal check, and we also check prenatally as well, so pregnant ladies that are coming in with pelvic girdle pain or wanting to get themselves prepped for birth as well. We also work with ladies around prolapse and, as I said, any kind of pelvic symptoms. So we are offering basically internal checks, so I kind of internally assess pelvic floor, because obviously that's a group of muscles that we don't sometimes consider when looking at kind of lower limb issues that we're having. So we make sure that we thoroughly check pelvic floor, and then we can run through the more kind of objective assessments to do with, it's everything from being in the gym, being really functional. Crikey, we see lots of netball players, lots of CrossFitters, so getting people jumping up onto the bar, trying their pull-ups again for the first time, lots of multi-directional work. So it's everything from internal assessment to getting into the gym and getting really functional as well. It's you don't even think about it. You just meet the patient and you're like, what do we need to get done for you, what's important to you, and it's so different. We have the forms that we fill in beforehand, so I read them through the night before, so I can be like, all right, this person needs this set up and I need to get that ready. So everything is so personable. It's really fun, actually. Makes it really interesting, each patient, because it's also knowing when you've done everything you can for the patient and you're actually, because there is a sliding scale, and physiotherapy is generally the first rung of the ladder, certainly in pelvic health. So 16 weeks of supervised pelvic floor exercises is the standard for urinary incontinence, stress urinary incontinence and pelvic organ prolapse. And it's knowing when you've reached your ceiling and having that discussion and making sure that, I think it's really important in therapy that nothing is a surprise. Like, physiotherapists need to always kind of be aware of, like, are we making objectively are we achieving the goals that we have set? And I think that's super important, of knowing when to kind of refer back. And it's mainly one diastasis patient in particular, I can remember being like, I think surgery is going to be the best option. We've got you this far, but we're just not going to be able to get you any further. And that's extremely frustrating, but at the same time really important, because she's so young. She's got 2 children that she needs to keep lifting, and she needed that support for sure. It was good. It was a really good thing to do.